So today we announced 71,197 cases of COVID-19 and a total of 6,085 deaths here in the state of Michigan. We had 891 additional cases that were reported today. So that's very concerning. Overall, over the past few weeks, we've seen increases in cases across the entire state, which again is very concerning. But each region looks a little bit different. I'm going to talk a little bit about that. The Grand Rapids region has our highest rate of cases at 53 new cases per million people per day. The Kalamazoo and Detroit regions both have over 30 cases per million people per day. Saginaw, Jackson, Lansing, and the Upper Peninsula have over 20 cases per million people per day. And for the Upper Peninsula, cases have been rising for 6 weeks, and this is the highest rate that they've had during the entire outbreak. Traverse City also has over 15 cases per million people per day, with cases steadily rising over the past 3 weeks. Overall, and this is good news, we have significantly increased our testing numbers to over 21,000 tests per day over the past week, and this continues to steadily increase. What's concerning, however, is that as we are increasing our testing, the percent of those tests that are coming back positive is also increasing, and that number is now up to 3.4%. That is up from 2.8% the previous week. 3% is the cutoff that a lot of national experts say is where you really want to be under. So this is an indicator that there is ongoing spread of the disease and that we are not simply seeing more cases just because we are doing increased testing. So we're seeing outbreaks in multiple settings, including bars, churches, offices, gyms, long-term care facilities, weddings, family dinners, parties. People are gathering. What we also know is that there are many cases where we do not know the source of the spread. And this is really important. This means that it is spreading in the community, and that's even more importantly why we should all be wearing our masks. The age distribution for cases has also changed. So now the group with the highest rate of new cases is the 20 to 29 age group, and that is followed by the 30 to 39-year-old age group. So this is a really important point. Young people have to understand that they are not immune to this disease. Young people can get very sick from this disease, they can be hospitalized, and they can even die. Even if someone no longer needs to be in the hospital, there are possible long-term health impacts from COVID-19, many of which are still unknown. People can have persistent lung damage. We're seeing studies and reports of possible long-term brain damage and psychiatric challenges as a result of COVID-19 infection. And even if you don't get very ill from the disease, think about the people that you can spread it to. People with underlying medical conditions, those who are older, people who could easily lose their lives. We know of families that have lost multiple people across generations because of COVID-19. So regardless of how old you are, do the right thing, not just for yourself, but for the people in your household, your family, and your community. No one knows how this disease could impact them. So just do everything you can to not get it. Wear your mask, wash your hands, and do not participate in large gatherings. It's very simple. So the increasing numbers we're seeing across the state also shows the critical need for testing and contact tracing, which we've talked a lot about, and which we continue to ramp up here in Michigan. We've continued to see a steady increase in testing over the last week, and we're moving closer to our goal of 30,000 tests per day. So testing is central to our ability to be able to contain COVID-19. So I urge everyone, again, please get tested if you're working outside the home. If you feel sick or if you've been close to someone who's been diagnosed with COVID-19 or they're having symptoms, you should get tested. The state has over 300 testing sites that are available. Many of them are also no cost. You can find a test site at michigan.gov/coronavirus test. We've also partnered with 211, so you can call them to get assistance in locating a testing site. We're also continuing to make good progress with our contact tracing. Our goal is to reach at least 90% of people within 48 hours of a positive test. However, unfortunately, we are completing over 70% of those interviews within that time frame. And so we are continuing to have challenges with people not answering their phones when public health staff call. Please pick up the phone if you see a call from your local health department. We're also seeing that in about a third of cases, people who test positive for the disease are not giving public health staff the information about their close contacts, even if they do pick up the phone. So we understand that individuals may feel uncomfortable about giving out names and contact information of their friends and family. We understand that. But please know that we do not share this information with anyone. But we will try to contact these individuals to make sure they know that they should quarantine and potentially get tested themselves. So this case investigation and contact tracing work is so important if we're going to be able to successfully slow the spread of the disease in our state. The state's also pushed millions of dollars out in funding to our local health departments so that we can hire additional case investigators and contact tracers for the fall. This will be incredibly important as we prepare for potential second surge. We don't expect there to be a widely available vaccine for COVID-19 for several months. We all know there is no antiviral treatment. So the most important thing, and really the only thing we can do to prevent spread of the disease, is to not come in contact with the virus in the first place. This means basic public health practices like washing hands, maintaining 6 feet of distance between you and other people, and wearing masks. And let me talk a little bit more about masks and why they're so important. So COVID-19, it's a virus. It's spread through droplets through the air, and they spread when people are doing simple things like coughing, sneezing, yelling, talking, or just simply breathing. Those droplets travel through the air. They can land on your face or in your mouth, your nose, your eyes. And once that happens, that's how people get infected. This is not a new concept. Okay, healthcare workers have been using masks to prevent all kinds of respiratory diseases for quite a long time. Masks work. A simple cloth face covering can reduce the chance of spreading the virus by about 70%. We've heard that talked about today. So I just want everyone to know this is not a joke. It is not a hoax. This is not about politics. Just wear your mask because you want to live and you want to protect those around you. It's one easy action that makes us all safer. I know it's been hard. For more than 4 months, everyone's lives have been completely changed. We can't do some of the things that we were doing before. But we can get through this together, and we will. And it will be so much easier, and fewer people will lose their lives if we are all patient and band together to fight this disease.